Hello, I'm Hannah Girk. I'm a registered dental hygienist, First Ambassador, and myofunctional therapist. I'm here today to ask you to think about a part of your body that you've maybe never thought about before. I want you to freeze, stop what you're doing, and think about your tongue. Where is your tongue resting in your mouth? Did you know that there's a correct spot for your tongue to rest? Did you know that where your tongue is resting in your mouth could be affecting your health? The tongue not resting in the correct spot can put you at higher risk for sleep quality issues. This could be from mild snoring to severe sleep apnea, or anything in between. The tongue not resting in the correct spot also increases your risk of sinus and allergy issues, chronic congestion, cavities, periodontal disease, headaches, jaw pain, depression, anxiety, and more. It is amazing that something as simple as where our tongue is resting can affect so many aspects of our health. Let's talk about where the tongue should rest. If this was your mouth, we have your top teeth and your bottom teeth. When you open, the roof of your mouth, where you can see those circles, is where your tongue should be resting. The tip of the tongue should be right behind the top front teeth on that top circle. It should not be touching the teeth, but pulled back just a small amount. There's little bumps of skin on that part of the roof of your mouth, so you can feel those with the tip of your tongue. The rest of your tongue should fill up your entire roof of your mouth, from front to back and side to side. It should not touch your teeth. A couple ways to help you figure out if your tongue is in the right spot is to say the N sound. N, N. Where the tip of your tongue goes to say the N sound is where the tip of your tongue should be resting. It can also help to click your tongue. When your tongue suctions to the roof of your mouth right before it clicks down to make the sound is where the entire tongue should be resting. Along with our tongue resting completely against the roof of our mouth, we should have our lips closed and be breathing through our nose. This is day and night when we're not eating, drinking, or talking. For some of you, what I just described is natural and normal. You keep your lips closed, you rest your tongue against the roof of your mouth from front to back and side to side. You breathe through your nose easily. You probably naturally had straight teeth. You probably don't suffer from allergies or sinus issues. You probably sleep pretty good. There is likely not any significant event that has went on in your life to result in your tongue not resting in the correct spot. The rest of you that have had braces to straighten crooked teeth, that had permanent teeth taken out as a teenager, that have been told you have a small jaw, that have sinus issues, allergy issues, chronic congestion, poor sleep quality, from snoring to sleep apnea, you likely are not resting your tongue in the correct spot. As a myofunctional therapist, I help you become more aware of your lip and tongue posture. I teach you exercises to improve the function of your head and neck muscles, including your tongue. I help you retrain your tongue to rest in the correct spot with your lips closed and breathing through your nose. Restoring the ideal muscle function with lips closed and tongue resting in the correct spot has helped many of my patients with their sinus issues, allergies, congestion, jaw pain, headaches, sleep quality, and more. You now may be wondering why your tongue is not resting in the correct spot. Part of my job as a myofunctional therapist is to help figure out why. One of those reasons might be a tongue tie. A tongue tie is when the tongue is physically stuck to the floor of the mouth and cannot reach the roof of the mouth. Tongue ties can be severe or mild. Another issue that could be causing your tongue to not rest in the correct spot is an airway issue. Anything that causes the airway to be blocked off to where you can't nose breathe can result in the tongue resting low to mouth breathe. This could be large tonsils, adenoids, deviated septum, or other reasons. Even if the cause of mouth breathing and tongue resting low has been taken care of and treated, your tongue may still rest low by habit. Another reason might be a past or present sucking habit, so sucking on a thumb, fingers, or pacifier. This places something between the tongue and the roof of the mouth where it should be resting. Even if the habit has stopped, the tongue still needs retrained to go to the correct spot on the roof of the mouth. One of the first steps to retraining your tongue to rest in the correct spot is to become more aware of it. On a daily basis, start thinking about where your tongue is resting and if your lips are open or closed. Start changing these habits and you might see an improvement in various aspects of your health and your life. If you need help changing these habits, find a myofunctional therapist. Thanks for listening. Now one more time, I want you to freeze and think about your tongue. Tell me in the comments where your tongue is resting. Is it against the roof of your mouth, laying in the floor of your mouth, half up, half down, touching your teeth, not touching your teeth? Tell me where your tongue is resting.